Good afternoon, everyone.
Hi.
Hi.
Thank you for the introduction. And I do not speak Thai, so I'll do my best to be as clear as possible. I'm wondering how many people here do not speak English. Is there anyone here? Everybody understands? Okay, because I'm not always sure with an audience like this, but I do have an interpreter if there's any issue. I've been asked to speak today on several topics. One of them is on Bio Identical Hormone Replacement Therapy. There are many different ways that we can give natural hormones to improve quality of life and to treat many conditions, and I'll go into depth on hormone replacement. I've also been asked to talk about detoxification a little bit, and also on some alternative cancer treatments. So with that, we'll get started with the hormone replacement. Hormones are a series of chemicals that our body makes. They're made by various organs and tissues in our body, the pituitary, thyroid, adrenals, ovaries, testicles. And they put out, these hormones have they give messages to our tissues and tell our tissues what to do. So the cells in various tissues in our body get the signal from hormones, and they tell our cells to perform certain functions. As you can see, there's sex hormones, estrogen, progesterone, testosterone. There are two main thyroid hormones. There are actually several other minor ones. The adrenal gland puts out over 50 different hormones. Most of us heard about cortisol or cortisone, aldosterone, DHEA and pregnenolone are also made by adrenal glands. They are extremely powerful chemicals. It's amazing how low a concentration of them can have a major impact on cell function. Most of the hormones tell the nucleus and the DNA of our cells what to do. And again, it's to perform certain functions. Our hormones typically are at their peak levels in our younger years, in our teenage and into our early 20s. But as we get older, our hormone levels tend to drop. And as these levels drop, then that signal, that information that the hormone is supposed to give to our cells becomes weaker, and that can make the cells and tissues in our body become lazy. And many of the functions that they perform are not as strong. Some people, there are a number of reasons why our hormone levels drop. You can say that it is a part of aging, but there are some other things that can affect our hormone levels that may be a result of environmental toxins, things like heavy metals and pollutants, nutritional deficiencies. Our body has to make these hormones, and it's like a factory. The glands that make hormones are factories, and if you don't provide the glands with the proper nutrients, then they're not able to make some of these hormones as well. But we now know ways to not only increase our production of hormones, but then when we can't always increase them to levels like they were when we're younger, we can also give them. And that's a big part of the branch of science in medical science now that we call longevity medicine. It used to be called more anti-aging medicine. That's kind of become an outdated term, and we're trying to, because we can't really turn back the clock. Our goal is to slow down the clock. Okay? Another term has been used here, restorative endocrinology. I basically, this slide just says what I just told you. Now, until fairly recently, well, actually, bioidentical hormones is not typically the standard of care. When doctors prescribe hormones to people, for the most part, they tend to be synthetic hormones, not the same exact hormones that your body used to make more of. For example, for many decades, a more common form of estrogen that women were prescribed was Premarin. And Premarin is made from pregnant horse urine, and it contains a number of different estrogens, only one of which overlaps with a human estrogen, estrone. So when you give hormones that are exactly the same molecular structure as the same hormones that your body used to make, then you're not introducing a foreign substance. And our bodies recognize it better. And it's a way of just augmenting what your body is just not making as much of, rather than introducing a drug that is a molecule that does not naturally occur in our body. If a hormone is low, you want to restore it. That's part of regenerative medicine. It's part of longevity medicine. With type 1 diabetes, for example, our pancreas doesn't make insulin, which is an important hormone for our body for many, many reasons. A very common condition, hypothyroidism, especially in women, is when your thyroid doesn't make enough thyroid hormone. Growth hormone deficiency is, when in its more severe form in childhood, is what causes short stature or dwarfism, and we now are able to give growth hormone to young children. But giving growth hormone to adults is something that is more recently used more again for longevity medicine and restorative medicine. Hypoadrenalism, a very common condition as well, although in typical Western medicine, anything short of adrenal failure is not recognized as a significant health condition. In more integrative medicine, the kind of medicine that I practice, we recognize that sometimes the adrenal can be mildly or moderately weakened, and that there's ways that you can augment adrenal function or replace some of the hormones, the bioidentical hormones, to the adrenal. So one of the things that we do with bioidentical hormone medicine is to try to pick and choose just the right hormones for that person. There's ways that you can do testing and monitor people and pick those hormones that work well for that person, rather than treating everyone the same and just putting everybody on the same program. I showed you here, I mentioned before the different organs here where hormones are made. And there are actually other organs that we don't often think of as endocrine organs. For example, our intestines. They actually make a number of different hormones. Our heart actually makes hormones, especially when you have a weak heart. The heart sends out a message, it sends out a hormone that is part of the way of telling the body that it is weak and that it needs help, something called natriuretic peptide. Is everybody with me so far?
Yes. Yeah.
Okay, good. So let's first start talking about the sex hormones, estrogen, progesterone, and testosterone. Our body actually make many, probably dozens of different estrogens, but there are three main estrogens that we make: estrone, estradiol, and estriol. They don't make them in the same amounts. We make estriol E3. E3 is the most abundant estrogen that we make, and E2 and E1 are made in much smaller amounts. But E2 is the most potent, and E3 is a very weak estrogen. But it must be an important estrogen because we make it, women, men make estrogen as well, although women obviously have a lot more than men. But we're still trying to learn all of the functions of E3. It's present in such high amounts. So estrone is present typically in small amounts. It's a very strong estrogen as well. And when women go from their years of menstruation into their post-menopausal years, they continue to make estrone because fat cells can make estrone. And that's one of the reasons why women, even after they're in menopause, still can have measurable levels of estrogen. But estrone is felt to be the form of the estrogen family that may actually stimulate estrogenic cancer tissues like breast cancer, ovarian cancer, and uterine cancer. So it's one that we need to watch closely. We don't want to give people estrone because of the possibilities of the negative effects. Estradiol, also a very strong estrogen, does have a lot of health benefits. Whenever you have your yearly blood work and your doctor checks your fats and cholesterol and lipids, and we measure HDL and LDL because those are the kinds of cholesterols. The HDL is the good cholesterol that protects us from hardening of our arteries, and LDL is the bad cholesterol. That's the one that contributes to hardening of our arteries. Well, estradiol actually helps to improve the good cholesterol and helps to lower the bad cholesterol. Triglycerides are the other fats in our blood other than cholesterol, and when they're too high, that's not good for our health. Estrogen or estradiol helps to decrease that level in our blood. We know that in women who have low estrogen that they're more prone to having weaker bones, and giving estrogen can help improve the strength of our bones. It helps to increase a chemical in our brain called serotonin, which is we often call it the feel-good neurotransmitter. When serotonin levels are low in our brain, it makes us more prone to depression and anxiety and insomnia. So having proper levels of estradiol can help that. It helps energy. It protects us from some damaging chemicals in our environment, so it has antioxidant properties. It's been shown to help improve or help sustain our good memory as we get older. And it's also involved in how we absorb certain nutrients like calcium and zinc. Estriol, again, it's the most abundant of the three main. When women are pregnant, it's made in very large amounts. The thing that's interesting about estriol is that it might actually even have protective effects on the tissues in our body that where the hormones may affect the growth of cancer. So, especially with breast cancer, there's evidence that estriol might actually help to lower either the incidence or how bad breast cancer can be. So as I mentioned, almost every tissue in the body can, every cell and every tissue just about can be affected by estrogen. It's particularly the brain. And one of the important things that estrogen can do is it increases acetylcholine, which is also another neurotransmitter, which when that level goes down is associated with poor memory and dementia. And so there have been studies showing that when you take estrogen that you decrease the risk. It doesn't take away it completely, but it may decrease your risk for developing dementia. It helps the insulin. You know, as we get older and our risk for diabetes goes up. Diabetes is due to our body becoming resistant to the effects of insulin. And estrogen helps to improve how the insulin works in our system so that it makes it less likely you'll be diabetic. Helps regulate body temperature. It protects muscle. It helps sleep. Women who have low estrogen levels often have sleep disturbance and insomnia, and taking estrogen very often improves that problem. Reduces the risk of cataracts. Helps keep your blood vessels elastic and not stiff. The stiffer the blood vessel, the more you'll run into problems with high blood pressure. It helps blood flow through small capillaries. There's a cell in our blood called platelets, and they're part of what's responsible for blood clotting. It's when we develop a blood clot in the arteries of our heart or our brain that is what causes heart attack and stroke. And estrogen has an effect of making those sticky platelets a little less sticky, so it decreases your risk for getting heart attack and stroke. Decreases the accumulation of the plaque that can build up and the hardening of your arteries. It enhances magnesium uptake, a very, very important nutrient for our health for so many reasons. And it also can help the elasticity of your skin. Keep your skin with fewer wrinkles. Helps decrease blood pressure, and then it helps decrease LDL, helps memory, reasoning and new ideas, actually fine motor skills. There have been some interesting studies with how well, writing and just fine hand skills. Keeps our skin moister and more elastic. And it also helps in the production of a natural chemical in our body that's involved in keeping our nerve cells healthy. Well, there's more estrogen does here. Actually, this is a little bit of a repeat. Again, HDL can increase by 10-15%. It definitely improves mood. So many women, as their estrogen levels drop and their serotonin levels drop, can get low mood and become depressed. And then what happens, a lot of doctors, they just treat it like regular depression and then prescribe you things like Prozac or Paxil or Zoloft or some kind of antidepressant medication, when really if you had, for many of those women, if you had just put them on estrogen or bioidentical estrogen, that could markedly enhance their mood, and I've seen that so much. I bet you there are hundreds of thousands of women in the United States who are prescribed antidepressant medication for hormone deficiency, and that's not good. Definitely increases libido or sex drive. It reduces homocysteine. That's a chemical in our blood that increases the risk for heart disease. It can be, I often have the women in my practice who use estrogen cream and apply a little bit of it to their face to help minimize wrinkles on their face. It protects your eyes against a condition called macular degeneration, which causes blindness in the eye. decreases risk for a very common cancer, colon cancer, keeps your teeth stronger, and again, as I mentioned, it affects brain chemistry to help improve mood. Now, there are, when you have an imbalance in estrogen, you don't want to have too much, because estrogen, if you don't have enough, it's not good. If it's too much, it's not good. You want to have the right amount. And here are some symptoms that you can get with estrogen excess. You can have heavy periods. It can increase your risk for breast cancer. It can overstimulate the immune system. Estrogen stimulates the immune system, and progesterone kind of helps to calm down the immune system. And it's the balance of those two hormones that are important with immune function. Too much estrogen can make your thyroid not work right. If you have not enough estrogen, it can cause fatigue. Take it. If you take estrogen, it might help your energy, but if you take too much estrogen, you might get then fatigue again. So again, it's important that you give the right amount. Uterine fibroids, which are benign tumors of the uterus, are stimulated by estrogen, so too much estrogen can cause fibroids to grow more rapidly. Abdominal bloating, intestinal bloating is also a problem with too much. Cervical cancer can also be accelerated with too much estrogen. Interestingly, not enough estrogen can cause depression, and too much estrogen has been known to cause depression. You can get water retention, headaches, and then too much estrogen can be too stimulating and then cause difficulty with sleep. So this is where, as a physician, when I prescribe estrogen, I need to monitor my patients, and we need to look at the levels, ask how you're feeling, how you're doing, and make the adjustments to get it just right for you. This idea that one pill fits all just does not work when you're doing hormone replacement therapy. Our bodies are constantly making estrogen, and then we also excrete it. But when you have too much estrogen, it could be, again, because you're taking too much, but it can also be because your body's not eliminating it the way it should. And that can happen. Women who exercise more, they get rid of their estrogen faster than women who don't. You can make more diets low in grain and fiber. One of the ways that we excrete it is through our gastrointestinal tract. And if you don't eat enough fiber, you can reabsorb the estrogen back from your intestines. So a higher fiber diet helps to keep the hormones, getting them flushed out of the system. And then the other big problem that is occurring more and more now in our world is that many of the chemicals that are used by the food industry, insecticides and pesticides that we spray on our vegetables and fruit, have estrogen-like activity. The way those pesticides work is that they're designed to disrupt the life cycle of insects, and they work, and it's worked that way through their hormone cycle. And so the other thing is in the plastic industry, phthalates and in canned foods, the lining that they put inside cans to protect the aluminum from the food, BPA, bisphenol A, those all have estrogenic-like properties. And so it's not just the estrogens that our body makes or that your doctor might prescribe you, but we're getting them all the time from our environment. The xenoestrogens, that's what I was just talking about. When they're coming from outside our body, they're called xenoestrogens. I mentioned to you about Premarin, which was the pregnant mare urine hormone. It's pretty the company that makes Premarin has huge farms of horses, and they operate on the horse to make their bladder empty into a tub that they have strapped to their body, and then they keep them constantly pregnant. And then when the fetus gets large enough, they abort the fetus and wait to impregnate the horse again. It's really a pretty disgusting way of producing a drug that at one time, not that long ago, was amongst the first, one of the top 2 or 3 drugs prescribed in the world. And then on top of that, you know, it was not, for the most part, was not bioidentical. We were putting over almost a couple dozen different hormones that were foreign to the human body. The other thing about when we give estrogen is that it really isn't good taken as a pill, because every time that you take any medicine by mouth and you absorb it through your stomach or intestines, all of the blood that drains your stomach and intestines goes directly to the liver. The liver processes what we absorb through our gastrointestinal tract before it then gives it back to the rest of the body. And the liver is a very important organ that metabolizes hormones. So when the hormone you take by mouth goes through the liver changes those hormones. It biochemically it changes the molecule, and that's how we can get a whole series of estrogen-like compounds after we take it by mouth. Now, when your ovaries made estrogens, they didn't release it into the intestine. So it didn't go directly to the liver. It goes directly into our general blood circulation. And so you don't get the same kinds of metabolites building up in your blood when they're taken, when your ovaries make them, or when you get them through some other method than swallowing them. So oral estrogens really are not healthy. And there are still a lot of doctors who are prescribing oral estrogens, and I just think that's really not good for your health. There was a big study that was done and finished about 10, 12 years ago, called the Women's Health Initiative. And it was a major study in its time that looked at hormone replacement therapy in women there was supposed to be about a 10-year study, but they stopped the study after about 6 or 7 years because they found that there was an increased risk for stroke and breast cancer and heart attack in women who were taking a hormone replacement. Well, it turns out that the women were all taking these for the most part, was Premarin, and the progesterone that they were given was actually not bioidentical progesterone, but it was something called a progestin. And these two drugs are much more powerful than human hormones. And so it's not surprising that there was the finding of potential negative effects. Now, sadly, that study, which was a huge study, and there was also another study done in England called the Million Women Study that showed a similar kind of finding. And so all of a sudden, this was about 10, 12 years ago, all these women who had been taking hormones were told to stop taking them and suddenly be put into having hot flashes again and having all the symptoms that you get when you're in menopause. And the women who had been offered bioidentical hormones, the natural bioidentical hormones, were excluded from this very important study. So I don't think the drug companies wanted to know whether the natural hormones worked better or had less side effects. So it was a missed opportunity to have to look at the bioidentical hormones, sadly. And that kind of testing is very, very, very expensive. So as of yet, we still haven't been able to do a huge study on bioidentical hormones. There have been many smaller studies that show its benefits and safety. But unfortunately, the FDA has not looked at those studies and felt that they were enough for them to approve bioidentical hormones. Now, that doesn't mean you can't take them and they can't be prescribed, but it does make it easier for your health insurance companies to not reimburse you for them. More and more now, insurance companies are starting to reimburse for bioidentical hormones. But bioidentical hormones are so much better for us that if you are going to be prescribed hormones, you really need to look in that direction. When we give estrogen to women, it's usually we leave out the estrone, the E1, and then we only give the E2 and the E3, the estradiol and estriol. It's a combination we call biased. Early on, maybe about 20 years ago, I've been prescribing bioidentical hormones now about 20 years. Initially, we used to give Triest. We used to give E1, E2, and E3. But because of the possible risk that we think are associated with estrone, we only typically give biased, which is estradiol and estriol. The other thing that we can do with natural hormones or bioidentical hormones is that we can make them to order. We can make different ratios of the estradiol and estriol. The most common ratio is 80% estriol and 20% estradiol. But when you work with what a type of pharmacy called a compounding pharmacy, this is not your typical Savon or Walgreens or Rite Aid pharmacy, but these tend to be more smaller private pharmacies that can make medications to order. You can make them into a cream or a lozenge or as a spray or ways that the drug doesn't usually come in, and you can have them make it to order. And that's also a very important part of bioidentical hormone therapy is working with good compounding pharmacies that will make these formulations for you to order. And you can measure these hormones in blood and urine, and you can adjust the strength and the amount and sometimes how much of the estrone and estradiol based on the testing. Here you can see you can do 90% estriol, 10% estradiol, or 80 and 20, or 70 and 30. If I were to say the average amount of milligrams of biased that I typically prescribe, it would either be in the 2.5 or 5 milligram range. And it's typically given as a cream. Most of the patients I prescribe it, it's a cream that you just rub on your skin once a day. You rub it where skin is very thin, your upper inner arm, your side, upper side or lower side, and your upper inner thigh. And you just rotate your sites. You don't use all your sites in one day. You, let's say, Monday, Tuesday, Wednesday, Thursday, Friday. And that way you don't want to keep using the same site all the time because you can not absorb it as well if you just keep using the same site. More information in here. So this is probably more information you need. When you give a 5 milligram bias to someone that has 80% estriol and 20% estradiol, you're going to be getting 4 milligrams of one or the other. That's more important for me than for you. Okay, progesterone. When women have hormone replacement, menopausal hormone replacement, you just can't give estrogen. You have to balance it with progesterone. And if you don't, there are potential side effects of long-term use of even bioidentical estrogen not balanced by progesterone. And the one that's most concerning is uterine cancer. When you stimulate the lining of the uterus with the estrogen and it's not balanced with progesterone, then that lining then can become toxic and more prone to cancer. So that's why it's always important to be taking both. Now, a woman who's had a hysterectomy and doesn't have a uterus anymore, a lot of doctors, most doctors, stop prescribing the progesterone. They just continue to give estrogen. But I think that is also not a good way to prescribe hormones. There are other tissues in the body that are affected by estrogen, and when not balanced properly by progesterone, can cause over-estrogen stimulation. The ratio here, typically you need a lot more progesterone, up to sometimes 10 times as much progesterone to balance estrogen. So here it says you take 5 milligrams of estrogen